This is Russ Ward for Pixels and Pills at the Social Media Conference, and I'm talking to Darshan Kalkani, and we're talking about compliance in social media. And I think it's a really important subject these days, particularly in the healthcare arena, and I think you were able to give us a presentation to help us understand more about that. So, Darshan, what can you tell us about it?
Well, when we started the discussion earlier today, it landed up being, I came with a set of presentation slides, and it landed up being a true one conference in that people had a lot of questions. We started off really talking about what is the state of the art right now. So most people, I had a list of things I thought I wanted to cover, but it turned out the presentation had a life of its own, and people talked about the issues that they're facing on a day-to-day basis. We had a gentleman who's had 20 years of experience in pharma, and he was still concerned, and we had people starting brand new, comparing what they're already doing, going, this makes no sense. So how do you compare what the state of the art is to where we're going? And how do you sort of synchronize what FTC guidelines are to the FDA guidances, or if you'd excuse me, lack thereof, and what that means for the future of social media in the pharmaceutical industry? And those are the issues we sort of talked about.
So are there some very simple, straightforward bullet points that you can tell us that are really important to consider?
A couple of easy ones would be know who your audience is. Depending on whether you're talking to a healthcare provider or you're talking to a patient, you would get two completely different answers, and completely different things that you can say depending on who's saying them. The next thing you need to worry about is, what is your message? Decide what your message is up front. Don't try to be fancy and try to combine messages and say this is a new type of message so it doesn't fit into the preconceived notions of what a message should be. The FDA has 3 types of areas it believes your messages fall into, and if it falls into one of those 3, decide which one you want and go with it. It'll make your life easier from a compliance viewpoint, and trust me, it'll make the lives of your bosses and the CEO, the chief legal officer, chief medical officer, their lives a lot easier.
So do you think there's a degree of real caution happening in the marketplace today in this subject?
There's definitely a huge chilling effect right now in the market. What's been happening is a lot of things that we took for granted a couple of years ago we've been told that those rules didn't exist in the first place. And a huge example of that is the one-click rule. For those of you who don't know what the one-click rule was, the idea was that as long as I make a promotional statement about a product, the original thought process was if I gave a link to the risk information, especially if I have limits on what I can say. So for example, on Twitter, I only have 140 characters. I say product X is excellent for X, Y, and Z disease. And then I just give a link on what the problems would be, the risk information associated with it. The thought process was, as long as I make that disclosure and I give a one-click, and the risk is only one click away, everything's okay. The FDA came out and said, we've never had a one-click rule. We don't know what you're talking about. That rule's never been there. So that sort of redefines what the pharma industry can say. And since it redefines what the pharma industry can say, it sort of redefines what the pharma industry is going to do from now on. And the reason it's become a much bigger issue is because when you start considering a lot of the legal and regulatory ramifications, there are actually criminal, civil, and administrative penalties associated with non-compliance. And this goes from sales reps on the floor who are actually in the day-to-day trenches, all the way through the digital people, all the way through the CEO and the chief legal officer and the chief medical officer being excluded. So, and there are people who are in retirement being sued by the Department of Justice. So when you consider all of these things in aggregate, there's definitely a chilling effect because people don't know what to do next.
So Darshan, it certainly sounds as if there's some real issues that people need help with. How might we be able to get more assistance if we need it as we go forward?
Usually, you can just contact me via @FDA Lawyers. If there's something I can do easily. If it's something that you need just some more personalized information on, I'd be happy to help as well. You can reach me at darshan@conformlaw.com. That's DARSHAN @conformlaw.com. I'm at www.conformlaw.com as well. And what you really want in the end, whether it's through me or through someone else, what you really want is someone who understands the clinical, the legal, and the regulatory aspects of what you do, effectively your MLR board. But you want to make sure that the MLR board communicates with each other, and you want someone who can minimize that communication. That's something I can help with. I'm sure there's some other people out there who can help with that. But what you want to do is reach out to these people, make sure you have an open and honest conversation about what you're trying to do. And that should hopefully get you started at least.
Darshan, thank you very much. We appreciate your time today, and we wish all of those watching good luck with your compliance requirements.
Well, thank you very much for having me. I appreciate this.
You're welcome.
Take care.